Imagine you're standing in the center of an amphitheater about to give a carefully crafted speech. But as you look out on the sea of faces, you realize that much of your preparation for this event didn't account for limited visibility. The facial expressions you relied on to communicate sarcasm wouldn't even be seen. Your gestures would be lost, if not exaggerated greatly. You neglected to consider the different skills you would need to utilize when speaking to a large audience. This is a vital consideration for effective speaking in different settings. Though tonight I'll speak of the field of psychology, these are fundamental principles that are applicable to any chosen profession. Tonight I will inform you about the various uses of public speaking that a psychologist uses in private therapy, group therapy, and large presentations. I met with Annie Gannon. She's a clinical social worker and therapist to discuss the ways that she uses effective speaking in her own profession. She's a clinician, and that means that she conducts private sessions in her office. She places importance on establishing credibility by presenting herself in her office as organized and clean. By listening intently and using eye contact, she ensures the patient that she's engaged. Private therapy has an expectation of confidentiality and individualized care. That means that the therapist must establish a rapport with the patient to glean insight and use deep and probing questions. This is only appropriate because of the nature of the privacy of this session. The ultimate purpose in private therapy is to establish rapport with the patient in order to properly diagnose and assist them in establishing healthy coping mechanisms through personal engagement. Private therapy sessions are more intimate in approach than a group therapy dynamic, which Ms. Gannon uses to facilitate and establish a supportive social network for her clients. Group therapy sessions focus on a group-led conversation. The therapist acts as a mediator and facilitator when needed. She must create a safe, judgment-free atmosphere through nonverbal acceptance and attentiveness, while setting boundaries for the benefit of patient privacy and well-being. This is a specific consideration that's taken for granted in a private therapy session, where a patient might be ethically pushed beyond their own comfort zone. It is imperative that the therapist remains impartial yet assertive to reframe speech if it nears hostility. In group therapy, the therapist's ultimate role is to mediate and facilitate productive conversation. These examples are focused on the interpersonal interaction. Yet another kind of speech a psychiatrist might be asked to give is a large-scale presentation. Evelyn Giddens, PhD and professor, often gives speeches on ADHD, bullying, and positive psychology to schools, colleagues, and special interest groups. The purpose of a large-scale presentation is to inform listeners. Therefore, the therapist relies on their own knowledge and perception as a psychologist. Ms. Giddens underscores the importance of research, knowing the audience, clear communication, repetition, and professional attire, and natural movements to ensure credibility on stage. A lack of gesture on stage may seem robotic, but not really so with a private therapy session. Though Ms. Gannon and Dr. Giddens each focus on different aspects of public speaking, they both draw on the knowledge that they gained through their education and applied to public speaking. They both emphasize function and importance of verbal and nonverbal communication to establish credibility. Ms. Gannon used her skills gained from her master's program to learn effective speaking as a clinician. She has extensive experience in nonprofit work, which helped her gain perspective and allows her to relate in a more meaningful way with her clients, thus gaining her own credibility. Dr. Giddens draws from her experience in school to aid in meaningful presentations. She suggested that joining organizations like the APA increases advantage in credibility and knowledge. From these two professionals, we can see distinct differences in the type of speech required for each setting. The ultimate purpose in the private therapy session is to establish a rapport with the patient to diagnose and assist them in establishing healthy coping mechanisms through personal engagement. In a group therapy session, the therapist's role is to mediate and facilitate a productive conversation by using and establishing a judgment-free environment. The purpose of a large-scale presentation is to inform the listeners through attention to appearance, research, organization, clarity, and experience. Clearly, these types of speeches that are required alter greatly depending on the setting and the purpose of the interaction. In conclusion, there are many methods that psychologists utilize in different settings. To establish credibility is of utmost importance. Yet tone, expression, focus, and purpose change drastically when speaking to an individual, facilitating a group, or addressing a stadium full of people.